to the press briefing today. With us are Dr. Chang Shuk-Kwan, Head of Communicable Disease Branch of the Center for Health Protection, and Dr. Sarah Ho, Chief Manager, Hospital Authority. Dr. Chang will first brief us on the cases. As of last night, we had 138 PCR positive tests and 135 RET positive cases for a total of 273 new cases. Since the fifth wave started, the cumulative number of cases was 1.19 million plus cases, including 1.19 million RT positive cases. We had some 741,000 PCR positive cases and 424,290 RT positive cases, including 25 reported by the HA, 23 reported by the CHP, and 23 from private laboratories. The CHP's laboratories carried out genome sequencing on 78 samples. 68 tested negative to L452R. 10 cases were indeterminate due to low viral load. Of the cases today, there were 27 imported cases. 17 were PCR positive. 10 were RAT positive. 8 were detected at the hospital. Some arrived in Hong Kong on May the 9th. 2 arrived on May the 8th. Of those who arrived on May the 9th, they arrived via 4 flights. 2 cases from CX 216, QR 818, CI 909, 1 case, UO 111, a single case. For flights on May the 7th, TK 083, there were 2 cases. Of the 19 other cases, they arrived in Hong Kong earlier. 15 were detected at quarantine hotels on the 2nd to 6th day. For the other 4 cases, 1 was detected on day 10 and the remaining were detected on day 12. 1 case was an arrival from India, a 22-year-old female. She arrived in Hong Kong on April the 30th, and on the 9th of May, she fainted at her employer's home and she was admitted to hospital. After being sent to hospital, her CT value was found to be some 43, and on May the 10th, her test result was negative. So apparently she was infected earlier, and that might be a case of reinfection. Another 3 cases, including 32, 22, and a 1-year-old baby, they arrived in Hong Kong from Singapore, Nepal, and UK respectively. They had high CT values. They did not show any symptoms, and one of the patients had an indeterminate result on day 16th. The same sample came back positive at our laboratory, and her CT value was very high. All 3 patients had very high CT values. The family of the baby tested positive in mid-April. So we believe that these were possible reinfections, and if genome sequencing could be carried out on the samples, we would conduct whole sequencing to see whether these were cases of reinfection. For residential care homes for the elderly, we did not see any new cases. And on May the 6th, the SWD issued a press release indicating that residents at all LCHEs and nursing homes in Hong Kong would receive PCR tests. And in recent tests, we detected possible reinfections. Some 3,000 samples were tested, and about 20 to 30 positive cases were found. CT values were extremely high, and the residents were living in homes that saw prior outbreaks. We would test further samples to ascertain whether they are reinfections. As for schools, we just had a long holiday. that lasted 3 days. We received 23 reported positive cases today, 26 through RAT and 8 through PCR. Of the 26 positive RAT cases, only 12 were samples from today. The remaining 14 samples were taken in the last few days during the holiday, and subsequently schools were informed. The 34 cases involved 32 schools, 31 students, and 3 staff members were involved. For the 8 PCR positive cases, only 1 sample was taken yesterday. The rest were taken a few days back, and subsequently the schools were informed. Of the 34 cases, there were 3 involving kindergartens, 14 students in primary schools, and 14 students and 3 members of staff from secondary schools. 3 schools recorded 2 cases over the past 7 days, and we saw that the students had no direct contact, and we will continue to monitor the situation. In terms of the fatalities, the HA reported 5 additional fatalities today, bringing the total to 9,061 fatalities reported by the HA. And together with other cases, the total death toll is 9,139, including 3,777 females and 5,300 males. In terms of fatality rates and breakdown, the distribution is similar to what we reported before, so I would not report them today. For the hot pot restaurant in or Peony Garden Golden Court restaurant in Yuen Long, we trace the compulsory test results of the patrons. We found that 8 more customers dined at that restaurant. 3 did a PCR test, including 171-year-old female and 2 of her family members. They dined at the restaurant, so there were 2 groups of people. Another 5 did RATs, including a family of 3 and 2 other customers. They started experiencing discomfort in recent days. They took RATs and the results came back positive. All staff members were tested, save for the person we mentioned yesterday. No other test results came back positive. We used the vaccine pass in our tracing work. We obtained the data from the vaccine pass of relevant individuals by working with OGO, and we sent out SMS messages informing them of the compulsory testing requirement by RAT. And after the tests were done, OGO provided exposure notifications to customers who visited the restaurants. That is, they were reminded to observe the CTN. For the 190 odd individuals, 17 customers tested positive, and 4 results were pending. And for 6 guests, we are still trying to locate them. We cannot connect through their phone numbers. In the early phases of the 5th wave, what we observed in this outbreak is similar at what happened back then. In other words, there were transmissions due to people not wearing masks. And that is why whenever you visit places in which people would be unmasked, please get vaccinated first. We saw that many of the cases were relatively old, but their symptoms were rather mild since most of them were vaccinated.
Good afternoon. There are 938 patients undergoing treatment at various public hospitals, Northland Hospital, Hong Kong Infection Control Center, and they're undergoing treatment there. Yesterday, we reported 2 patients who were in critical condition. 1 was in serious condition, 4 in critical condition, and now in ICU. Another 5 cases of death were reported, and the 5 patients in the past 24 hours passed away. 3 men and 2 women, aged from 68 to 95. Of those who died yesterday, all were relatively old, from 65 or above, elderly people, and 1 came from a residential care home for the elderly. 3 were not vaccinated. 1 had 1 jab, and 1 had 2 jabs. In the past 24 hours, 79 patients recovered, of whom 36 have been discharged. In the 5th wave of epidemic, 48,950 patients have been discharged, and 381 already left hospital. And in the early 2022, 61,331 patients have been discharged since then. And there was a patient who actually was confirmed to be infected after being checked into the hospital, and there was 1 close contact identified. In terms of staff, so far we've got 22,630 staff infected. Of them, 22,496 patients have returned to the posts. So now it's time for Q&A. Please raise your hands and use the mic passed to you. Before you ask a question, please introduce which media outlet you're from. This one, please. Good afternoon. I'm from TVB. I want to ask about, just now you said that there were several re-positive cases. So what is the risk of people having re-positive cases? Is it easy for those cases to be spread around? And why the re-positive cases emerging? And also there are experts who said that by the end of June to implement the 3rd phase of vaccine pass, that will be too late. So based on the current trend of the pandemic, do you think there's a need to ask the public to receive the 3rd jab earlier? And also another question for HA, if there were to be more clusters of outbreaks in the future, are you prepared in terms of having enough manpower and equipment? And also in February and March, the number of infections were at record high. So what lessons have you learned so that we can be better prepared for possible high infection numbers again? Well, there are 2 types of positive cases. One is, for example, out of the 1 million people who were already infected, and maybe among them, even though these people have recovered, literature and our past experience have told us that these recovered patients could be carrying fragments of the virus for some time, for a few weeks, for example, or even 1 to 2 months or 3 months. So should this be the case, then the virus is not really infectious. But if you were to undergo a mandatory testing or PCR test, because of the sensitive nature of the test, so some fragments of the virus could be identified, and the CT value is normally above 30, quite high. Another possibility of positive cases is that the person might not be aware of having been infected or did not report their infection after they were infected. They did not make any report. At the Hong Kong U projection, even though we have got more than 1 million cases reported, but there could be up to 4 to 5 million cases, many of which unreported. And if these cases had no symptoms, or for these people who were infected but did not make a report to the platform, or for all sorts of reasons did not make it known, then Of course, these people are could be still carrying the virus, or for cases without symptoms in the premises where there was an outbreak, and they may use RAT tests which did not identify or did not give them a negative result on the spot. But if they do a more thorough test, or if we do thorough tests at, for example, a residential care home, then these hidden cases could be identified. So for some positive cases, their initial test results may have high C value, or test results might be uncertain. But if we do the retest again on the next day, then the C value remain high, and these could be positive cases. So they're no different from the cases found before. They're not infectious. They're not infectious. As for your second question on vaccine pass, I think the administration has made some arrangements and they have their own plans already, so I'm not going to supplement on that. Earlier on, in public hospitals, we have converted about half of emergency beds to receive patients infected with COVID-19. We've got 11,500 beds for COVID-19 patients. Some hospitals have been converted into designated hospitals for COVID-19 patients. And we've also suspended some non-emergency services or non-emergency surgeries or treatments, so as to concentrate our resources and staff to fight the pandemic. But you know that we've got 900 plus patients now undergoing treatment at various hospitals as the pandemic eases. We have seen actually a decline in the demand for the designated beds. So some hospitals have started to receive non-COVID-19 patients, and we're going to restore some non-emergency hospital services, in-hospital services, and some A&E departments of some hospitals actually have actually now, as the pandemic has eased, the A&E department of this designated hospitals have gone back to receiving all sorts of patients, not just those infected with COVID-19. So we monitor the changes, development of the pandemic in terms of the A&E department services and the beds. We will make sure that we have enough resources to cope with the need and to meet various needs. Next one, from Cable. On the confirmed cases, you mentioned an imported case which was discovered on the 10th day, a girl from Indonesia. How about the Indonesian employer? Was the employee infected? Did he catch the virus from her? And how would you assess the current pandemic situation? Next Thursday, there'll be a next new phase of relaxation of social distancing measures. Would there be a chance of rebound in the number of cases? And the chief executive said that there's a chance of early relaxation of the rules. What do you think of that? And also for the hot pot cluster, so far the hot pot restaurant has not ceased their operations. Do you think there's a need for the restaurant to be closed? And experts have suggested that restaurants should have a suspension mechanism as well. So what do you think of the proposal to impose the suspension mechanism on restaurants? And also, besides some quarantine centers and community isolation facilities used for quarantine purpose, what other facilities are there as backup for quarantine purpose? The Indonesian identified on the 10th day she was feeling unwell and was hospitalized and underwent a test. So far, her family members, since they lived together, were classified as close contacts. So they will need to undergo testing and be home quarantined. And so far, we haven't found or discovered any of the members were infected yet. The next phase. What's your question regarding the next phase? Your assessment of the pandemic. Well, the pandemic situation fluctuates, and with about 200 to 300 cases per day, so some fluctuations. we need to observe the situation for some more time to see if there's a rebound.
陸續放
Once social distancing measures are gradually relaxed, we expect a greater flow of people. So it would not be too surprising to see a rebound because it is something to be expected. As for the hot pot restaurant, patrons would dine there in the morning. Most of the cases dined at the restaurant in the morning on May the 10th. In other words, it's been more than 10 days since we have been tracing these cases to see if there were other close contacts so that they could be isolated or quarantined. We visited that restaurant, and so far there is no evidence or evidential circumstances that were remarkable. We ordered the restaurant to carry out disinfection. All the staff of the restaurant and diners were tested, so we believe it's not necessary to suspend its operation. I think we have to look at the cases based on the circumstances. We do not have fixed criteria for suspending a business or restaurant. Next question, please. This is Hong Kong 01. For the cook who tested positive, who worked at Peony Golden Court, did he belong to the same cluster? All the patrons dining at the restaurant had to be vaccinated. Does it show that the vaccine pass has not been effective? In terms of objective, what is the goal the vaccine pass is trying to achieve? Some experts pointed out that in our road to normalcy, it's not necessary to investigate every case in detail, and it is also not appropriate to investigate particular clusters. What is the CHP's take on that? And experts also recommended a targeted approach in fighting the pandemic. Again, what is your take on this? Whole genome sequencing normally takes a few days. So the samples analyzed yesterday, we would still have to wait a while for the results. For those entering relatively high-risk premises such as restaurants, one has to be vaccinated. From these cases, we could see that there were probably many such cases in the community, but it is rather difficult to identify the actual place of transmission in the community. Restaurants are relatively high-risk places since patrons would not be masked, but there could be transmissions elsewhere as well. After the fifth wave started, we carried out some investigation. Omicron is a highly transmissible strain, so transmission is entirely possible. We still see a few 100 new cases every day, not just in restaurants, but also in other places. For restaurants, we require the use of the Leave Home Safe app and vaccine pass. So by receiving vaccines, you can protect yourselves and others at these premises, since infection is more likely at these high-risk places. And even if you are infected at these premises, the likelihood of death or serious complications is still lower. So that is one way the vaccine pass would help. And it also helps with contact tracing or case tracing, since the vaccine pass contains some personal particulars and contacts, and as such, we can obtain the necessary information from Mogio, and we can send messages to the people involved, and we can order compulsory testing, etc. And our work could be a lot more efficient. In the past, we had to get in touch with restaurants to obtain Octopus card and credit card information, and we had to check payment information which could be incomplete. That was a time-consuming process. For those who paid by cash, there might not be a phone number we could trace. So there are still many cases in the community. So we could not say that transmission at the restaurant could affect the entire community. It simply shows that at places where people have their masks off, like restaurants, Omicron could still infect a lot of people. So for those who are not fully vaccinated yet, please do so as soon as possible. Next question. This is AM 730. First of all, a question about the cases today. You talked about the 20 to 30 suspected reinfections by the SWD. Can you tell us the age distribution and which care homes did they come from? For the imported case, for the baby who tested positive on day 12, which country did he or she come from, and were his family members affected as well? Domestic helper, why did she fainted, and did her conditions improve? You said you would carry out whole genome sequencing on the sample of the cook from that restaurant. So if there's now more than one variant in the community, how can you ascertain the link between his infection and the restaurant? And diners who visited that restaurant might have to be quarantined. Could they quarantine at home, or would they be sent to quarantine facilities? If they would quarantine at home, could the household members go in and out freely? And would an exemption be offered for those who needed to be quarantined? The baby arrived in Hong Kong from UK via Turkey, and he had 3 family members who tested positive in mid-April. For the positive case who tested positive on day 10, she was a foreign domestic helper. She was admitted to hospital, possibly for non-COVID reasons. Her condition is stable, but I do not have the details. The BA 2.2 strain is now commonly found in the community, but even for BA 2.2, there could be differences between different individuals in SMP. So even in the same cluster, we would need to identify any differences between the genome sequencing results. So there could be differences within those infected by BA 2.2. We would consult our virologists for their opinion. The close contacts are currently quarantining at home. And the same tiered approach would be adopted if their home environment is not suitable for quarantine, or if they are relatively old, they would be sent to community isolation facilities or other facilities. If an independent room could be arranged at home, as well as an independent bathroom, then they can undergo quarantine at home. In case of home quarantine, household members can enter and leave home freely, but the prerequisite is that there must be an independent room and bathroom, and the patient would need to dine alone. In other words, the patient should be separated from the rest of the family. In terms of quarantine, no exemption arrangement is provided for those who once tested positive. Or perhaps I would clarify the answer later. They were relatively old. They came from 15 residential care homes.
Gentleman over there. I'm from Mingpao. The Yunnan Peony Golden Court restaurant. You said that eight eaters tested, and there's a woman sharing table with another. And what about the other two identified on a different table? And do you have the vaccination record and symptoms of the eaters identified today? And also for compulsory testing, you said 7 have not been traced. So how would CHP try to locate them? And also like to know about how does the CHP think of the scale of the cluster and its trend? Are you expecting more cases to be found related to this cluster? And of the more than 10 confirmed cases, what sort of impact would it have on the overall trend of the pandemic in Hong Kong? And also the expert suggestion that is it that for each restaurant cluster, do the restaurants need to be subject to suspension of operations? And also, what is the CHP stance and criteria? Is it that only high-risk restaurants should be subject to the mechanism, or should all restaurants should be required to comply if there's a cluster? And also for the 20 to 30 cases at residential care homes, are they reported cases involving elderly residents? So how about residents who live in the same homes? Would they need to be quarantined or what? And also, you found through PCR tests, which is more sensitive, finding positive cases throughout PCR tests. Do you think that RAT can replace PCR? And also, I'd like to ask about the situation in schools. In the past 3 days, there are 34 cases. What do you think of this ratio? Is it high or low? And also, do you think that there could be more cases that have because of the long holiday? Just now, I said that there are 8 more customers at the restaurant identified. I would say that most of them are aged from 64 to 89. One was a 4-year-old child who went along with the family members. So I don't need to disclose the ages of individual customers, but they have all been vaccinated besides the child. And the 6 customers, well, we are still trying to trace them using the telephone numbers left by them. Of the altogether 17 customers are involved in the cluster, and it's a small number compared to the overall number of cases on a daily basis. Of course, we will still follow up on this cluster and see if there's a major outbreak or if there are any chances of further transmission. But on the whole, I don't think it really impacts a lot on the overall pandemic that we're facing. And based on information provided by family members or companies, we'll see whether there are any other clusters at companies. And for the restaurants that the customers concerned have visited, we'll also investigate and see whether there are similar clusters or outbreaks. So we need to see, how long ago, how many went to a particular place and so forth. So I can't give you an overall conclusion assessment now. As for the elderly residents who through PCR tests were identified as positive, many actually had very high CT value and the results were uncertain. But for those confirmed in the laboratory, we will carry out one more PCR test to confirm whether they are positive cases. So far, we wouldn't remove those residents or isolate them. But if PCR test results again show a low CT value, then that means they are new cases and we might have to trace the close contacts. Ultimately, PCR is a golden standard. So for the 5th wave, in residential care home for the elderly, the outbreaks were quite common. So we are expecting that there are some cases infected that were not identified maybe doing testing because they use RAT, therefore they were not identified. And therefore, we want to find out more about the situation in residential care homes. So PCR test is a good yardstick. For schools, as I mentioned, even though there were 34 cases, but only 12 were cases that tested positive today. The others were found over the weekend. So that's expected because you would expect that every day there would be new cases. The last question, this lady there. 凤凰卫视。
这一轮就是近日呢，香港的
In terms of the COVID positive cases in Hong Kong, it has remained at the in 2 digits. What is your take on the trend of COVID going forward? As for the restaurant in Yunnan, multiple diners and staff members tested positive. If we see further infections, would the SAR government's plan to reopen bars and specific premises on the 19th of the month be affected? The recent caseloads have remained at around 300 cases per day. The trend might go down or plateau for quite some time. And as our social distancing measures are gradually relaxed, we expect a greater flow of people within the community, and that is why the caseload might plateau for some time. As for transmission that occurred at this Yunnan restaurant, perhaps it is rather commonplace among restaurants in Hong Kong. In the early phases of the 5th wave, we carried out detailed investigation and we saw many such instances in the community. Omicron is highly transmissible. At restaurants, people would take off their masks and they would sit rather close to each other. And they typically stay for a few hours and they would chat and so on, which could lead to infection. As for the other circumstances or scenarios, for example, on public transport and in other cases, transmission can take place as well, as we saw already. I believe such scenarios are not unique to Hong Kong. It happens in other places as well. It's just that sometimes they go undetected if no cluster is formed. This is the end of the press conference. Thank you. The speaker is not coming through the microphone. I understand there are quarantine facilities for exceptional circumstances. For example, those who could not undergo home quarantine. The speaker is not coming through the microphone.
As we mentioned, right now in hospitals, we've got about 11,000 beds for use for the COVID patients, and our AWE also are in backup state. And earlier, some patients were transferred to Hong Kong ICC, and we continue to monitor the situation and the need for overall services before we adjust our service provisions. Whether A&E and hospital beds, actually we have our own mechanism, and if there's a need, we will reallocate our staffing and resources to meet the needs.